Hello, hello. Here's a presentation led by Dr. Meep and Dr. Jingles. Today they will be discussing schizoid personality disorder.
Schizoid personality disorder is something that affects the way someone interacts and expresses their emotions. SPD, schizoid personality disorder, stems from schizophrenia. This disorder is caused by emotional trauma, often within the stages of early adulthood.
Factors that increase the risk of developing this disorder include people with a family history of schizophrenia, schizoid or schizotypal, have a neglectful parent that is unresponsive to emotional needs. People with low income, low level of education, history of divorce are also at risk.
About 3%, 6.3 million Americans, are diagnosed with SPD. The disorder is more common in African Americans, Native Americans, and Hispanics, and is less common in the Asian population. It occurs at equal rates for men and women. SPD is diagnosed if a certain criteria is met that cannot be explained by schizophrenia or any other psychotic disorder.
These are some of the criteria for diagnosing SPD. Does not want or don't enjoy relationships, even with family. They are not interested in sexual relationships. Chooses solitary activities. Does not find pleasure in many activities. Seems detached. Are dull and humorless. Socially distant or cold. Are not concerned with the opinions of others. Indifferent to both criticism and praise. Difficulty relating to others in social situations, and are frequently daydreaming or creating vivid fantasies involving complex inner life experiences.
SPD often has features of schizotypal and paranoid personality disorders, such as being odd and eccentric. Though very similar to schizoid personality disorder, Asperger's syndrome has shown inability to empathize, while SPD deals with apathy towards others' emotions. Asperger's is also generally linked to the autism spectrum, unlike schizoid.
Right now would be the time where we list famous people who have been diagnosed with SPD, but due to the disorder causing them to find more comfort in solitude, the desire to become famous is almost non-existent.
There are, however, many whom experts say showed signs or symptoms of SPD, but weren't diagnosed. For example, Albert Einstein, Charles Darwin, and Stephen Hawking. Though there hasn't been a full psychological examination to determine whether or not they have or had SPD.
People with SPD may also have to cope with depression and anxiety disorders. They are also at an increased risk of developing schizophrenia, schizotypal personality disorder, or other personality and delusional disorders.
There isn't much treatment for SPD other than cognitive behavioral therapy and psychotherapy. Although patients are very quiet and reluctant to join group therapy, it's shown to be beneficial for patients, although its effectiveness has not been fully studied. Mood stabilizers and antidepressants tend to help with the anxiety or depression one might feel as well. When people with SPD become overtly paranoid under stress, they should be treated with neuroleptic drugs. Drugs like olanzapine, risperidone are usually used because of the less frequent side effects and are treated at low dosages. Many with SPD don't realize that they need help and don't seek any until the stress has taken a toll on their everyday life and relationships.
This is a case report published in the European Journal of Psychiatry. It is a story of a man with SPD and how it influenced his daily life.
Mr. D had a normal childhood with normal attachment to his parents. He had friends up to the 10th grade. Going into his senior year of high school, Mr. D was happy and looked forward to university college. He was an excellent student. However, he was small, shy, and nerdy, and sometimes teased by the other students. In this senior year, he developed a kind of depression which lasted the entire year. The cause of this depression is unclear. He spent most of his spare time in his room and sometimes wept. After graduation, his depression was gone, and he left home to study mathematics and electrical engineering. He developed a temper in his 20s. He cursed loudly and sometimes at himself if he made a stupid mistake. His temper improved when he became older, as he got more insight into human nature. For example, small talk was difficult for him to understand in terms of why people did it. When he was in his early 40s, he finally became aware that people might actually enjoy small talk. He realized that small talk is only satisfying if we think that the other person is paying attention and is responding to what we're saying. Nowadays, he still does not have any need for attention, but at least he makes the effort to reciprocate greetings and gestures of others, although he does try to avoid small talk. When he is engaged in a conversation, people aren't likely to see much of his emotions, such as humor, enthusiasm, passion, affection, or sympathy. He is unable to convey a genuine sense of joy in seeing a person again. He is not able to enjoy life as much as other people do. Even his most intense feeling of ecstasy is not very intense, and they don't last for very long. He has these levels of subdued emotions for almost 40 years since he was 18. There is an emptiness, a lack of interest, and a lack of caring. He reported that it's like being dead inside. He demonstrated a lack of enthusiasm that manifested itself. He had never had a meaning in life and has never been very passionate about any particular activity or belief. Not being able to enjoy life was linked to his limitation of his basic needs over the years. He had only worked about half his adult life. This was easy since he never had much enjoyment in spending money. When he was working, he accumulated tons of money that are not in a bank account. All that he owned was either stored in a small Foot Locker, his car, or his workplace cubicle. He owned a 7-inch black and white TV with no audio CDs. The closest thing he had to a hobby was tinkering with electronics that he buys at the flea market. He never had any desire to participate in any sports or any outdoor recreational activities or to travel and see the world. He had never any desire to own real estate. After his landlady passed away 7 years ago, he decided to live in his car temporarily until he found a new place to rent. But he concluded that living in his car was just as comfortable as living in any apartment, so he lives in the car ever since. His sexual needs seem to be stuck in that pre-adolescent age. He has some feelings for the members of the opposite sex, but the feelings are not strong enough for him to do all necessary work to make himself more physically attractive. Over the years, he did not care that much about his appearance or health. He hardly visited a dentist or a doctor over the years. His father and brother passed away in recent years, but he did not attend their funerals. But he did not feel much grief in losing a father or a brother, and he did not feel much guilt for not going to the funerals. He had never had a general hostile attitude towards anybody. He could not remember the last time he loved, hated anyone, or never felt seriously guilty or shameful about something. With no emotional attachment to others for the last 40 years and no reward in social interactions, he experienced no motivation to learn how to recognize and respond to the feelings of others. His disorder might be triggered by the lasting depression during his adolescence.
Currently, there needs to be more insight into what causes SPD in order to make better diagnosis and therapeutic programs.